I have better news today with case counts being lower over the past few days. Here are the numbers. Since this time yesterday, we've identified 77 new cases in Philadelphia residents, bringing us to a total of 34,886 since the beginning of the epidemic. Since this time yesterday, we identified 0 new deaths from the COVID virus. Our total is 1,763. If you notice, that's one lower than I announced yesterday because we did decrease one with cleaning of our data. Update on our college-associated cases. Around the country, we are still seeing outbreaks in many areas where there are colleges, the colleges and the towns around them. The Temple University outbreak appears still to be subsiding. That's very good news. However, we're still concerned about the potential of spread in other colleges here. So we're asking all the colleges in the area to do what they can to prevent social gatherings amongst their students, which is what appeared to be driving the outbreak that we did see at Temple. A reminder on indoor dining that started 2 days ago here in Philadelphia. We're asking all the residents that are starting up indoor dining to do that in ways that follow our precautions that are on our website. Those include no more than 25% capacity of the patrons at any one time. The diners need to be more than 6 feet away from people at other tables. That everyone should wear masks except when they're seated at tables and actually eating their food. That there's no bar service, no alcohol served except as part of a meal, and the staff need to be wearing masks and face shields for their own protection. If anybody sees restaurants that are not following those standards as they're starting up, please call 311 and we'll send out an inspector. Now on Tuesday, Governor Wolf announced the expansion of restaurants' capacity that he would allow up to 50% effective September 21st. Now, as the city that's been hit hardest by the epidemic, in the past we've said that we will be more restrictive than the state if we think it's necessary to protect Philadelphia residents. That's the case now. We've reviewed this proposal and we're not going to be making the change here in Philadelphia on September 21st. However, if the case counts continue to decline and there are no problems elsewhere with the 50% limit, we will consider making that change here sometime in October. I want to talk a little bit about gatherings. And our current limit for gatherings is 25 people indoors and 50 people outdoors. Our experience has been that outdoor gatherings, though, are less risky than indoor gatherings. We have few, if any, reports where it's clear that spread occurred outdoors. We have many examples of spread of the virus indoors, even in some very small gatherings. And there's also, I believe, increasing evidence that the virus may be transmitted through the air. So that means that the air movement that occurs outdoors would be protective. Now, all gatherings create some risk of spread, but if people want to gather, I want to encourage them to gather outside instead of inside. That could be anywhere from a small meeting to a performance to religious services. So we will be increasing our limits of outdoor gatherings from 50 to 150 effective next Monday, September 14th. We will keep the limit on 25 people indoors because we do see indoor gatherings as much higher risk. Now, the important notes here, though. The virus still can clearly be spread by droplets, which can travel whether you're indoors or outdoors. So people still need to keep a 6-foot distance from others when they're gathering outdoors. And that means that, and the virus can still be spread also through the air, even outdoors. So that means that people need to be wearing masks when they're gathering outdoors. And it also means that gatherings involving food and drink, where people are not masked, are still going to be risky, even outdoors. So that we recommend that when people do gather outdoors, that they avoid serving food and drinks. Now, in that context, let me just note that this weekend is going to be the first Eagles game, and everybody's looking forward to that. That's going to be great. Some people may want to tailgate to get together with people to enjoy that game. Let me just point out that getting together in a crowd over snacks is still high risk, even if it's outdoors. So we recommend that people who watch the game do it just with members of your household, not with a group of friends. Now, as the mayor said, the first COVID case in Philadelphia was reported 6 months ago today, on March 10th. So I thought it's worth just taking a little step back and look back at what's happened in those 6 months. We had, as everyone here knows, a very difficult time in March and in April. Initially, testing for COVID was available only at a few sites and only for people meeting some very strict criteria. And the results of that testing took more than a week to get back. Many people who had symptoms had difficulty getting tested at all. Nonetheless, cases that were diagnosed rose very rapidly over the first 4 weeks, from 10 people total in the first week to more than 2,600 in the fourth week after the epidemic first hit Philadelphia. Our hospitals with so many cases came under strain, And on April 24th, we peaked out where there were 1,881 people hospitalized in all the hospitals in the Philadelphia region. With that, deaths from COVID rose quickly as well. In the first 4 weeks, we went from 12 per week to nearly 250 deaths per week. Since those dark times, we've made huge progress. Testing is available in Philadelphia now at some 60 sites, and now we're doing about 3,000 tests per day, and people are getting their results in 1 to 2 days. We're now diagnosing about 700 to 800 cases per week with that expanded testing. Most of those cases are in younger, healthy people who handle the infection pretty well. As of yesterday, there were a total of 175 people hospitalized for COVID in the entire Philadelphia region. That's a decrease of 90% from our peak back in April. And as of the last week in August, we reported only 4 deaths from the coronavirus infection. That's a decrease of 98% from our worst week in April. Now, initially, to slow the epidemic, as you know, we shut down almost every activity here in the city, from schools to stores to restaurants to theaters to all sorts of gatherings. We all had to learn about keeping a 6-foot distance from others. We had to learn about hand washing and hand sanitizer. And most of all, we all had to learn about masks. Since then, we have gradually and carefully and successfully reopened. We reopened stores, then outdoor gatherings and outdoor dining. We reopened barbershops and salons, indoor shopping malls and museums and gyms and schools and colleges. Now, more than 90% of people in Philadelphia, when they go into a store, are wearing a mask. And that mask wearing has enabled us to reopen these activities without seeing a surge of the virus. And during those 6 months, we've had big advances in medicine. We now have better treatments for the coronavirus. The drug remdesivir being shown that's effective. Dexamethasone is also effective for treating people with serious illness. And convalescent plasma looks like it's helpful for some patients with severe infections. At the same time, we've seen very rapid progress on development of a vaccine against this virus. So that's what's happened over the past 6 months with the progress. Now, what do the next 6 months look like? Well, we expect to continue to gradually restart and reopen those activities that we've restricted in the past, while continuing to reemphasize safety, especially that people need to wear masks. Now, we expect that there will be some temporary setbacks and some reversals, especially as we get to winter, but the long-term trajectory is clearly towards returning to normal. We expect more advances in medicine over the next few months to make the disease more treatable, and we definitely expect more advances in development of the vaccines. I hope that we'll be offering a vaccine in the early months of 2021 in the city of Philadelphia. And it may even be on a limited basis in the very end of 2020, we'll be offering a vaccine to some people. So overall, this has been very rough on everyone, and there's more difficulty ahead, but we are very much recovering. And I know through all that, through those many 6 months, it's difficult for people to maintain the safety precautions, but we need to continue to limit how we get together to avoid more cases and more deaths. More than anything else, people need to wear a mask when they're near others, including that means their relatives and their friends, which is what most of the transmission is occurring amongst relatives and friends these days. This is true for everybody, but it's especially true for people who are vulnerable, those who are over the age of 65, and those people who have chronic medical conditions. For more information on all that we've done and where we're going, go to our website, www.phila.gov/COVID. Thanks.
A question first on indoor dining. Do you all have any, does the city have any idea sort of how many restaurants are already offering it at this point? I know some weren't going to right away. And how's it going? Has the city been checking out places that are offering it?
Yeah, we did not ask restaurants to notify us if they're going to be opening. We're going to be inspecting restaurants according to our routine. So we don't have any numbers right now on how many of them are offered indoor dining. And it's really just too early. It started on Tuesday. We have sent staff out to educate restaurants and our inspectors are doing their inspections, but I haven't gotten any data back about how it's going.
Okay, and another question for you, Dr. Farley. I'm wondering how contact tracing is going. How many people has the city been reaching, and what are we learning about how the virus is still spreading?
Yeah, I didn't have numbers to update you with today. We'll follow up with numbers on that. I just didn't get the numbers before the press conference. I can tell you in general that we're reaching a lot of people. There's still, I'd say our biggest problem is we have maybe between 20 and 30% of people who don't pick up the phone. and we're working on mechanisms to try to encourage people to do that. When we do get people on the phone, we do get information about their contacts, and we are counseling a lot of contacts. We think that contact tracing was helpful in containing the outbreak at Temple. But outside of that outbreak, I think the biggest learning is that transmission is occurring within households and with relatives and close friends. And that's an important insight, and that's why I've been mentioning that risk to people on these calls.
And I know I should probably know this, but what is the maximum occupancy for indoor events?
25. That's at the governor's level, and likewise here at city.
Okay, so it's still 25. Are there any plans to expand that to allow for more people in an indoor gathering? We
have no plans to expand that right now. The reason we expanded the outdoor gatherings is to encourage people to go outdoors, especially when the weather is nice as it is. We think people can gather much more safely outdoors, and so we prefer to have that difference as a way of encouraging people to do that.
Okay, thank you.